Pete, thank you. We do begin this morning with developing news on the Ebola outbreak. Ashoka Mukpo, the Rhode Island man who contracted the virus while working as a news cameraman in Liberia, is expected to be flown back to the U.S. today. Now, he'll be taken to a special isolation unit at a hospital in Nebraska. And his parents tell Eyewitness News he is in stable condition right now and also in good spirits. Well, meanwhile, a Massachusetts doctor who was successfully treated for Ebola at that facility in Nebraska back in the hospital this weekend. As we first told you last night is breaking news at 11. Dr. Rick Saker was admitted to UMass Medical Center in Worcester on Saturday with a cough and a low-grade fever. Saker originally developed Ebola while treating patients with the disease in West Africa. Well, Dr. Robert Feinberg, a professor and chair of medicine at UMass Memorial Medical Center, released the following statement to Eyewitness News saying, quote, "We are isolating Dr. Saker to be cautious pending final confirmation of his illness. We think it is highly unlikely that he has Ebola. We suspect he has an upper respiratory tract infection with symptoms of cough and conjunctivitis." Now, we expect an update from Dr. Saker's condition later this morning. Well, a recent diagnosis of a man in Texas with the disease is fueling fear Ebola could spread across the country now. We spoke with one local doctor who says one of the things he's trying to do is calm those fears while still preparing his hospital should the virus show up in our area. Eyewitness News reporter Madeline Wright continues our in-depth coverage.
More than 3,400 people have died from the Ebola outbreak in West Africa. And now there's a patient who has the disease in Texas, sparking fears the virus could spread and come to Massachusetts, something doctors say is unlikely.
This is one of those viruses that provokes nightmares.
Dr. Najam Zaidi from South Coast Health in New Bedford says modern infection control should prevent any cases of the Ebola virus spreading in the United States. But he doesn't rule out the possibility of an isolated case.
One of our worries is, gee, what if it comes to a hospital? Say a patient walks in with a fever or abdominal pain or a lot of those vague symptoms in a hospital.
Zaidi says if that happens, doctors at South Coast would check the patient's travel history to see if they've been exposed to the virus. And if they have, they'd be put in an isolated room.
Healthcare workers have to take some special precautions, wear gloves, impermeable type of gowns. And as long as you don't get splashed by that patient, you're not going to get the disease.
Zaidi says the virus has put the Liberian community in Rhode Island on edge. He says he and another doctor have spoken to them to calm their fears.
There's a lot of anxiety, but a lot of these people haven't really traveled to Liberia recently.
That was Madeline Wright reporting. Stay with Eyewitness News and WPRI.com for continuing coverage of the Ebola outbreak. We'll keep tracking Dr. Saker's condition at UMass Medical Center, as well as Ashoka Mukpo's impending return to the U.S. today. You can find extended coverage online right now, including information about symptoms, treatment, and prevention of the Ebola virus.